Okay, this video is called Is Vitamin B12 Fake? And where does this come from? It comes from reading this book right here. This is a great book. It's called The Enigma of Vitamin B12, Nature's Only Mistake? Question mark. Fear and Marketing of the Deficiency Myth by Anthea Hayes. This is a brilliant book. And I can tell you, I came to the conclusion after reading this book that I stopped taking B12. Okay, so now I'm going to talk about the reasons why I stopped taking B12. And I'm not even sure it's real. I'm kind of thinking it's not real. I'll tell you why. She went in this book through all the papers on it, and she came to the conclusion it doesn't even exist. It doesn't make sense that it doesn't occur in the plants in nature. And when you go back through the original research on it was totally corporate funded by drug companies, and it seems like it's fake. And some people say, well, how could you say that? It's so many journals, it's in so many books. I can tell you, I've read the medical books backwards and forwards, and there's tons of things that are in conventional medical books that are completely untrue. And they're big things. They will tell you that they don't know the cause of insulin resistance and diabetes. Completely untrue. We know very well. It's especially fat, especially sat fat. They're going to tell you that 95% of hypertension is essential, of unknown cause, idiopathic. But that's completely untrue. We know that at least 95% of it is simple dietary things like eating high-fat, high-sodium diets and low in potassium and magnesium. We know that, okay? So what I'm trying to say is, they'll tell you that they have no idea what causes autoimmune disease. We know that leaky gut's the main thing that causes it. So what I'm trying to say is the conventional medical books are full of things that are incorrect and untrue from top to bottom on the big issues, not on the small things. They'll promote the somatic mutation theory of cancer rather than the metabolic theory of cancer. We know the metabolic theory is much, much better. So what I'm saying is don't be surprised when you hear something about a vitamin and it's not true. Okay, for example, she talks about how food companies, vitamin manufacturers, often like drug companies, they want to claim there's a widespread deficiency and then to get approval to put it into the food because then they can make tons of money off it. Like iron fortification, that's completely ridiculous. Most men after their 20s are iron overloaded, okay? Women after their 50s. And you really shouldn't be iron fortifying foods. It's really bad for people. Okay, but now somebody's making tons of money off doing that, and then they want to try to put other things into foods, omega-3s, vitamin B12, vitamin D, etc. I think it's a bad idea adding this stuff to food, okay? She says vitamin B12 does not exist in nature. She says it's just a cyanide snake oil. All forms of it contain cyanide. The highest amount of cyanide is in the cyanocobalamin, so that's the worst. But she makes a point that there's also some cyanide in the other forms, including, methylcobalamin and hydroxycobalamin, okay? And I did used to take one of them. I stopped taking it. I'll tell you another reason I stopped taking it. I've been a neuroradiologist for over 25 years, special training and reading tons and tons and tons of spine MRIs, brain MRIs, neck, you name it. All right, well, the reason I bring this up is in all these years, I've only seen one case that had findings that were maybe related to B12. Probably not even B12. And it's called subacute combined degeneration, high T2 signal in the posterior cervical spinal cord. If subacute combined degeneration was real due to vitamin B12 deficiency, I would have expected to seen it more than that. And you even look it up, and it's not that easy to find cases. Dr. McDougall said he was not sure about vitamin B12. Something didn't make sense about the literature. Jeff Nelson said he wasn't sure about it and he wasn't going to take it anymore. I don't know if he restarted or not, but I know at one time he was saying that he probably wasn't going to take it anymore. So I don't know where he's at on that right now. So I haven't checked with him, so I don't know for certain. You'd have to ask him yourself. But what I'm trying to say is I have seen so much lying and so much dishonest stuff in the literature that I believe it's not true. I'm not 100% sure. I'm going to have to read more papers, and I haven't fully resolved the matter. But the weight of the evidence at the current time is that it's not even real, that it's just a made-up thing to sell stuff. Okay, once the drug companies get involved, anything they fund is you can't trust it because they're always trying to make money. If they weren't going to make money off it, they wouldn't fund it. And the drug companies were really big on this. Okay. So I wrote in here, I said, McDougall was unsure about it, Nelson was unsure about it, and the high-fat phonies say it's real, therefore it can't be real. I'm just kidding. Also, she pointed out a couple other interesting things. She talked about synthetic vitamin D that a lot of people take. She says it will often contain formaldehyde, hexane, and cyanide, and sometimes aluminum. So that's like poison, okay? Go out in the sun. The sun's what you really want. She felt vitamin D, synthetic vitamin D, was quite a bad thing. McDougall felt it was a bad thing as well. He has a whole lecture on that. She said cyanide is quite popular in synthetic vitamin supplements. I put the page numbers on here if anybody wants to. It's a great book. Here's the book. Sorry, let me grab the book here. I read it really fast, cover to cover. It was really easy to read. I was just walking on treadmill. I'm like, wow, that's interesting, that's interesting. That's what I do. I always fold it up and then I summarize the notes here. I haven't gone through all the papers myself. It's just because I had been thinking about quitting vitamin D. Some of the other things she said about vitamin D were quite disgusting. She says it is routinely made out of human feces, out of sewage, sludge. Okay, why should you have to make it out of that instead of some plant like almost everything else is made? That's real suspicious, okay? What else? She said that creatine very often will contain some cyanide, the supplements, which is real counterproductive. If you're taking that to increase your energy level, cyanide's a major mitochondrial inhibitor. It's going to counteract the benefits, okay? And there's other things that have some cyanide in it. Almonds, that's one of the reasons why I don't eat almond. Flax can have cyanogenic chemicals in it. It's another reason why I wouldn't eat it. And you have to ask yourself, what path are you going down here? If you're eating almonds, like a lot of the high-fat phonies recommend, and taking vitamin B12, like the high-fat phonies recommend, and eating flax, like the high-fat phonies recommend, how much cyanide are you ingesting? It might all add up. Why go down that path? And then the other thing that was suspicious about B12 was the difficulty in getting reliable blood levels. Then they're saying, well, we don't really know what the blood levels mean. We don't really know what a normal level is. You'll also have to check, malonic acid. You'll have to check other things. And even those you can't really trust. So just take the supplement. What's the truth? It's hard to know. Nathan Pritikin back in the day around 1980 would say, well, he'll maybe allow a little bit of meat to get vitamin B12, but he wasn't sure. That's why he wasn't always 100% vegan. Part of it was also because socially it made his diet more acceptable to people who eat a little bit of animal foods. Okay, but what I'm trying to say is there's good reason to be suspicious of it. Lots of people wrote to me and said, oh, gee, they never take B12 or they're perfectly fine as 100% vegans. Some of them did say, oh, they've heard of people who were low in B12 and then got supplemented with it or got the injections of it and they felt better. I don't know how much of that's placebo. I have had an internal medicine doctor tell me that they gave vitamin B12 injections to some patients and the patients felt that they improved. I don't know if that's placebo or not. Just like some people used to think that antidepressants, tricyclic antidepressants and selective serotonin reuptake inhibitors had a beneficial effect on them, but those are brain poisons. So it takes a while for the dust to settle to know what the real truth is. But where things are at, I'm not believing it. And it's been a couple months that I haven't taken any, and I don't intend to go back to it. I'll see how I feel. I can always recheck my level, see if it changes. But I'm just letting you know that's where I'm at on it now. Things might change for me.